Hello all. So today we'll talk about Varicella-Zoster virus or Chickenpox virus. So this is somewhat similar to what we have seen earlier, the herpesvirus family. So this is basically a different manifestation. That is, the varicella is a primary infection where the patient has not been exposed to this virus on earlier. The herpes zoster is basically a reactivation of virus that was there in the system already. And this is somewhat similar to the herpes virus. The varicella virus and herpes virus are somewhat similar. The difference is that they don't grow on experimental animals or on the chicken embryo cells. So if you want to grow, you can grow it on a tissue culture, like you can do a human fibroblast, human amnion, or helio cells. And the destruction of cells in this tissue culture is slightly less compared to what you would see with the herpes simplex virus. The virus will remain inside the cell itself and does not appear in the tissue or the culture medium. It can be distinguished between different types by using a anti-sera, and there's only one antigenic form known for the Varicella-Zoster virus. Now let's look about the chickenpox or the disease caused by this particular virus. So it's a very common infection in childhood. It's a very mild infection in most of us, and most of us would have had this infection also in the childhood. The adult patients, if they develop chickenpox, is a more serious person or serious form of the particular disease. The chickenpox spreads from person to person, and the infectivity is very much maximal at the initial stages. Even before the skin rash appears, the infectivity is more. The virus will be seen in the upper respiratory tract, and slowly they will have this lesions into oral cavity, and the lesions, the skin lesions, will have a vesicular fluid which is very much uh, loaded with the virus particles. And as the disease progresses and there is a scab formation, slowly the infectivity will come down. And as far as this infection is concerned, there's no animal reservoirs. How does this infect us? Basically, the virus enters via the respiratory tract or the conjunctiva. After incubation period of 1 to 3 weeks, slowly the lesion starts with a very non-specific fever. There can be some buccal lesions, but generally we don't uh, look at the buccal lesions at the earlier stage. And slowly there will be a skin rash on the trunk, and basically it's on the central part of the body, so the centripetal distribution, and it spares the hands and legs. So this is basically what happens with the lesion. So you have a macule followed by a papule, then slowly the fluid fills in, so that's called as a vesicle. The fluid becomes more pus filled, so it's called as a pustule, and finally when the lesion ends, it ends with a scab lesions. So this is the same kind of a lesion over a different period, like from the time the infection starts to the time it scabs and leaves out at around 2 weeks time. So these are the lesions you are going to appreciate in the cutaneous part of the body. So the rash involves only the superficial layers. So it's what is called like a dew drop appearance. It just appears like a drop of dew on the leaves. Okay. The rash will appear in small groups or what is called as crops in 3 to 4 days interval, and it matures quickly and slowly crusts off around 48 hours. And so in a patient, you will see lesions of different stages. Some of them will just come up, some of them which are slowly turning into vesicle or pustular stages, or some of them which are just scabbing out. So basically, you have a period of entry of virus followed by the incubation period, then a short clinical illness, and slowly the recovery. In adults, the symptoms are pretty much severe with more systemic symptoms. The rash is very much profuse, and the rash can also become hemorrhagic. Sometimes there can be bullous lesions. The surrounding few things can join together, become a bulla. They can be pitting, can be more, and they can be varicella pneumonia, which is very common. Sorry, what not very common in children, but is common in adults. And if at all it happens in advancing age, it can also prove to be fatal. The complications of the disease, if you see, the patients can develop myocarditis, nephritis, acute cerebral ataxia, meningitis, encephalitis, or these lesions can become secondarily infected with bacteria like Staphylococcus and Streptococcus. Ray's syndrome is a particular disease where it is seen when patients already taking salicylates and not in everybody. Chickenpox during pregnancy is a very dangerous condition to the mother and the baby. Because of the hormonal factors, the disease is more severe in pregnant women and it can lead to complications. The fetus can develop some complications based on at which part of the pregnancy the mother has developed the infection. So the first half of the pregnancy is mostly a asymptomatic disease, but can also come with a what is called as a fetal varicella syndrome, that has scattered skin lesions. There can be hyperplasia of limbs, chorioretinitis, and CNS defects, and some of the infants can also carry a latent infection. The baby, if the chickenpox develops near delivery or within the towards the delivery time, the baby can develop congenital or neonatal varicella within 2 weeks of birth. If the mother of the baby develops infection within the last 1 week of a delivery, the generally the fetus can escape, but the because of the antibodies also passed on to the baby. But if the infection less than 1 week, then only the infection would have passed, but the antibodies would not have passed. So it has a very serious infections like disseminated disease, pneumonia, or encephalitis. So treatment it can be with the Varicella-Zoster antiserum plus the chemotherapy. Lab diagnosis is usually a clinical diagnosis. Generally, lab does not play a bigger role here. But yes, you can definitely look for the multinucleated giant cells wherever there is kind of a doubt. You can do a look for the Cowley type A inclusion bodies. Again, the Toledan blue stain, what we heard about the herpesvirus can be used here. Electron microscopy can be done. There can be virus isolation from the buccal mucosa, and it can be inoculated on the human amnion, human fibroblast, or the other cell lines. Uh, the antigen can be detected using immunofluorescence, antibody immunofluorescence, or you can do a ELISA or a PCR as well. There have been many attempts to somehow prevent this infection. So, 1974, we had a live attenuated vaccine which is given subcutaneously. It had a good immune response, but needed to be kept in a frozen condition during storage. So that was in 1974. It's called as a Oka strain. Later on, there's a lyophilized vaccine where you give one dose subcutaneously for a child between 1 to 12 years of age, and around more than 12 years, you have to give 2 weeks doses around 6 to 10 weeks apart. And any live attenuated vaccine is generally contraindicated during pregnancy. You can also do a passive protection, that is varicella-zoster immunoglobulin, that is prepared from patients who are just coming out of the disease. It can also provide passive protection to immunocompromised children, but the only problem is such kind of the immunoglobulin is slightly difficult to get, and it's not very much useful in treatment of the current condition. Treatment wise, you don't need to treat everybody. It's a self-limiting disease, but in a specific set of patients like immunodeficients or elderly patients with the complications, you can do a acyclovir or famciclovir can be used for treatment. And steroids are generally contraindicated because it will increase the chances of the patient developing pneumonia or disseminated disease. So that is basically about the chickenpox virus and the disease. Hope it has been simple. Thank you.